So John Bruno and Nancy Muller brought up a great question, and they wanted us to touch on EPM and how it affects a racehorse. So I will refer to the doctor here and let her kind of dig into some of the medical terminology, and then I'll talk to you about the trainer side of what I used to see.
So EPM is one of the most complex things to talk about. So I'll try to pare it down and give a brief summary as best I can, but please bear with me. Basically, it's equine protozoal myelitis. So there is a protozoa, which is a parasite called Sarcocystis neurona. And it is transmitted to horses via infected possum feces. So the horse eats the feces, it's a contaminant. So either the food isn't being stored properly or they're getting into areas that they shouldn't. And that's how horses are becoming infected. Side note, please don't go kill possums. They do eat ticks and venomous snakes and unwanted pests, so they're not all bad. So a lot of this is just, keeping the grain in storage bins and just better husbandry. But unfortunately, once a farm does get EPM, a lot of the horses can get that. Now, basically with EPM, they pick up the parasite. A horse can be infected without showing the clinical signs, so without having actual issues. And so diagnoses can be very difficult, and oftentimes it's overdiagnosed because we haven't ruled out other causes of the neurological signs. So basically when a horse gets EPM, they show neurologic signs. So they're showing ataxia, which is incoordination and difficulty balancing. They can have muscle loss, weakness. With EPM specifically, the muscle atrophy and the ataxia is usually asymmetrical, so it's usually one-sided, which is important to note because there are a lot of other diseases that EPM can be confused with that show symmetrical muscle weakness and symmetrical ataxia. EPM can often be overdiagnosed because, especially at the racetrack, racetrack vets are phenomenal, but as being a racetrack vet, your focus is lameness, your focus is performance, castrations, things like that. So internal medicine, you practice it, but it's not the forefront of your practice. So with EPM, unfortunately, because it is so difficult to diagnose, a lot of times it's not properly diagnosed at the racetrack. Usually, in an ideal world, you check the CSF, so the cerebrospinal fluid. So you do have to do a spinal tap to get that, in addition to checking the blood serum. Now, as you can imagine at the track, most of the times, just due to the high risk nature of getting cerebrospinal fluid, it doesn't often occur. So oftentimes, even though it's not preferred, we're making the diagnosis via a positive serum blood test, an IgG test, plus the neurological signs, plus the history of potentially having EPM. So it's a diagnosis of exclusion. In an ideal world, if money isn't an issue, when you first see a horse with neurologic signs, you would do imaging, you would do x-rays of the spine, you would do MRIs, CT scans, check the spinal fluid, because you need to rule out other diseases. The most common one that you need to rule out is wobblers. So wobblers is when a horse is born and the spine is impinged by the vertebrae. So that is the biggest thing to rule out, and most people don't do their full due diligence due to cost, of sending the horse out for those types of imaging, and so then they just diagnose EPM. So unfortunately, a lot of the times it is overdiagnosed, and we don't always get it right. Treatments, there's Protozil, there's Marquis, there's Panazaril. These are basically just oral medications that you give. They're labeled for about 28 days, but usually treatment far exceeds that. It's a couple months. So I hope that explains it in a nutshell, but again, it's pretty complicated overall.
So she actually made a great point point in all of this, and it's something that, because it's becoming overdiagnosed and becoming so common, and my father, who is an internal medicine specialist, and this is one of his specialties, they're now seeing resistance to medication because medication is being kind of overused to treat things. So now, before you used to be able to use Marquis, and Marquis would pretty much take care of it. Now you have to balance it out in the racing world, and you use Marquis to really try and knock it out of their system, and then you put them on Protozil pellets daily to try and maintain to help them come back. With EPM, from a training standpoint, it depends on how far gone the horse is neurologic-wise. Some horses can recover, but sometimes some of the damage that they've done to their front joints due to being so neurologic behind, it's tough, even once you do get them right, to bring them back.
But also with that, it's not just their joints. When the parasite is affecting the spinal cord and or the brain, the reason that they're showing these neurologic signs is due to inflammation. The spinal cord is becoming inflamed and irritated, and so sometimes that damage is irreparable.
And so I'd seen it in various forms and in various cases, and some I was able to bring those horses back. Some you just had to call it quits as soon as you saw them. I mean, there was one filly I received as a 2-year-old that I saw her walk into the barn and loved her. I thought she was probably the best 2-year-old that I've ever had in a barn. I took her to the racetrack the first day, and she was completely neurologic. And I called the farm. They said, well, she always moved, quote unquote, funky behind. But she was full-blown neurologic. We actually sent her to the Ruffian Center to do a spinal tap. And at that point, it was going to be a losing battle to try and get that filly back to racing. Now, I think she did go on and become a broodmare, but from a racing perspective, it was a no-go. She was not.
Did they ever confirm EPM versus wobblers?
No, she was confirmed.
She was.
Yeah. So she was retired at 2. She did not make it to the races. And then actually, when we were looking at all this, we did image her front ankles, and there was enough arthritis and damage done at the 2-year-old stage from having EPM that it just didn't make sense to try and get that filly right to get her back to the race. She was always going to have problems. I had other horses where there was minor deficits and things that you could work with once you treated them. And going from a trainer's perspective, and this is something I'd read about from a horse that actually was a wobbler. So some people might not know this. Shamardal, one of the leading stallions in Europe, was a wobbler, had basket surgery, which is, as Dominique talked about, when you have the 2 vertebrae impinging the spinal cord, it kind of pulls the vertebrae and helps. So they're not impinging the spinal cord, if I'm correct.
I mean, it's usually just a stenosis, and so with a basket surgery, they open that up. So it doesn't necessarily have to involve 2.
When I read about how Mark Johnston, who was the trainer of Shamardal, how he trained Shamardal, Mark put miles and miles and miles into that horse. And so when I started thinking about that, I said, that's interesting. Maybe if you build enough of a stamina foundation on these horses from a stamina level, that will then take over from a coordination level, and you can start putting speed work in. So what I used to do with horses that were EPM after we treated them is I would gallop them longer than I did my other horses that were fully coordinated, because the miles on the odometer strengthened everything on that horse. So it would strengthen their back a little bit more. It would strengthen some of the structural ligaments and kind of the musculature a little bit more, and build more stamina into that individual. And then when I finally asked them to go fast, because we'd built such a solid foundation, we were able to do fast-paced work and build them up to becoming racehorses and actually succeeding at the racetrack. And there was one, and Dominique and I will spill the beans on this a little bit. When we got engaged, her father decided to send me a horse, and I panicked. And I called her and I said, well, is he giving me this horse to own, or am I just training it? And she said, well, what's the issue? And I said, well,
what isn't the issue?
I said, what's not the issue? She's got bad ankles, bad knees, she can't breathe, she's got a bad back, and she's EPM.
And she was, she just freak out and practically try to kill you for nothing.
And that's
she's dangerous.
So that's the other thing that people don't talk about necessarily with EPM is when some of these horses have EPM for quite some time, they're not only their coordination but how they read the environment around them, their proprioception and understanding. They'll overreact. This filly would literally act like a scared cow and trample people. She was kind of dangerous at times. So once we treated her for EPM and got her right, I started galloping this filly 2 miles a day, 2 miles a day, 2 miles a day. And we got her stronger and stronger and stronger as we got her back end stronger. Her issues with her ankles and knees went away because she was not overusing herself in the front end because she was engaging her hind end. And then one day, a rider made a fatal mistake, which actually was an incredible discovery. So I'd asked the rider to gallop 2 miles, and I don't know if he'd been drinking the night before, but I'm standing at the pole, and off she goes, and she goes around once and a second time. And I don't see him slowing up, and then all of a sudden she passes me, and she goes around a third time. And I panicked. I'd never seen a racehorse gallop 3 miles on a dirt racetrack. And so I told the rider, I said, Jesus, this filly's going to run in a month, and you just galloped her 3 miles. What the heck are you doing? Lo and behold, I come back the next day, and there is straw everywhere in the shed row. It's outside the stall. It's everywhere. And I go into the stall and I look. I think this filly should be knocked out and sleeping. She's bucking, kicking, jumping, excited, feels great. And I said, that's interesting. So then I started balancing that out. One day she galloped 3 miles. Another day she galloped 2. I balanced that out until finally we got her ready to run, and she won. She won at 35-1 in her second start. And that was it. She made it to the races, she won, and then we retired her, and everybody was happy. But yes, it is difficult. Some horses, it's minor. You treat them, they come back fine, they're perfect, there's no issues. But what I always found with race horses who had EPM and who had shown some of those neurologic signs, both on the mental side of how they kind of read the environment, that it's not just proprioception, it's they have trouble with picking up cues, right, from the environment, from the people around them, they're just a little bit slower.
Because it depends
mentally
on where the lesions are. If they're in the spinal cord, it's very different than if they are in the brain. So if they are in the brain, I would assume that would affect their mentation a little bit.
Yeah, so that's kind of what I learned with these horses is you have to balance it and check at each horse. How far are they gone? How do they respond to medication? I've been around some horses that you treat them and they're fine. You never have to put them on medication again.
And sometimes if you don't treat them long enough, they can actually regress again. So again, some people treat them, 2-3 months. Some people even keep them on the pellets for
forever,
indefinitely. So unfortunately, there's no strict treatment about what should or shouldn't be done. It's very individual. There's just a lot we don't know about this particular disease, so it's kind of just very, very variable per horse, how they're going to respond, what you need to do, how long treatment lasts.
So there you go. You got 13 minutes about EPM, so thank you very much for tuning in.